Hello again, friends. This is Eric. Um, this is my third short video today. And again, just to reiterate, I'm a internal medicine resident down in South Texas, and on August 7th, my mother passed away from COVID-19. So this video might be a little about mom, but mostly it'll be just a touch about COVID. I'll go more in depth with the COVID discussion later. This, I think, is a very important topic, however, and it's advanced medical directives. The advanced medical directives don't necessarily have anything to do with COVID, but they're very important to do. And in the hospital, I try to talk to all my patients about what they want to do. And so we'll talk briefly about this. Will not be all-encompassing, but it'll be a brief couple minutes just on a general overview, and more so why I think that it's important to do this. So what is an advanced medical directive? It tells us as the physicians what you would want done in certain scenarios. Most commonly, it refers to if you have cardiopulmonary arrest, meaning your heart stops suddenly from, you had an arrhythmia or a myocardial infarction, also known as a heart attack, or you got very hypoxic, meaning you have low blood oxygen levels, which we are seeing in COVID patients, or after a trauma or something like that, where your heart and or your breathing difficulties result in stopping of the function. You essentially become unconscious, and in order to save your life, we run what is called a code. You see them on TV, but in real life, they're nothing like what is on TV. Okay, we follow normally what is called an advanced life support, ACLS, okay, where we do chest compressions, meaning that we're pushing on somebody's chest fairly hard. Ribs may be broken. Typically, the patient is also intubated. Okay, so that whole pack, we give medicine for their blood pressure to keep it up, etc. And then those patients will get put in the ICU if they're in the hospital already. If they're coming from outside, the ER doctors will take care of that, and then they will go to the ICU. Now, why is it important to have an advanced directive? And first off, this advanced directive will tell us, do we do the code? Do we run the code on you? Yes or no? Or, and as part of that, you can choose to be a DNR, or do not resuscitate, meaning that if something like that happens, we would not follow that protocol. It can say, do the chest compressions, but don't intubate me, or give me the medicine, but don't do chest compressions. There can be some variations in those things, but a lot of doctors, usually if one of those things happens, then you need to be intubated. Now, depending on the medical condition or what happens, sometimes we can, you need to be intubated, but you don't need the chest compression part. So it's complicated. It's not a one-size-fits-all discussion or scenario. But a lot of times, if the heart stops, the patient will need to be intubated. And sometimes people will say, do the chest compressions, but don't intubate me. And sometimes certain doctors will not, they will tell you, like, no, if we do this, I'm going to have to intubate you. If you don't want to be intubated, then I don't want to do the other stuff because it's futile. But that is a discussion that one would have with your doctor. That I'm just giving you some examples. Now, these, you can find an advanced directive. You can get them from a few different places, but the one that I easily found the other day was from AARP, and you can navigate to that. You can even do it in the Google search bar. Advanced directive. AARP is usually one of the first things that pops up, and then you pick your advanced directive based on the state you live in, because it'll be somewhat tailored to state laws. It's going to be a difficult discussion to have with family in most cases. People do not like to talk about death and dying. They don't like to talk about the possibility that they will die or when they will die, etc. And it's understandable. I, as a doctor, do not take that discussion lightly myself. They tend to be somewhat touchy, difficult, and emotional discussions. But I highly suggest that you do it, and I suggest that you do it sooner than later. This is particularly more for adult patients. Children are generally treated in the fashion that we do everything, unless the parents are there and they say something otherwise. But now, I do internal medicine. I do not work with children. So from my viewpoint, this is adults, an adult discussion. I suggest that every single family member, friend, everybody should do it. And it's better to do it sooner than later, preferably, when you're healthy. Cognitively, you're there enough to make these type of decisions, and you sit down and you talk about it so that everybody is on the same page. Okay? And then you make a copy. Everybody knows where it is. Everybody knows what your wishes are. And that way, if something happens unexpectedly, they will know what you want. It's a little easier if things start to, let's say, for instance, you develop cancer and the doctor tells you, we've reached the end of the road. There's nothing else we can do. What do you want? Do you want to go on hospice? Do you want us to stop treating you for other things and just make you comfortable? That you can sort of see coming. You can talk about it as it comes up. It's still better to think about those things ahead of time, but this is particularly important. Advanced directives are particularly important in the event that something happens in an emergent or unexpected fashion. And this is where I'm going to tell you a little bit about what happened with my mom. My mom is 59 years old, going to be 60 in October. Earlier in July, my mom, I guess, had some encounter with somebody that had COVID. She didn't know that. She started to feel a little ill, I guess, and she just thought it was a cold. After a week and a half, 2 weeks, she got tested, ended up being positive. Another week or so, week and a half, she wasn't feeling any better. She went to an urgent care. Her oxygen levels were very low, and they sent her to the hospital, when she got admitted. She required oxygen. There was a day or two where she started to feel a little better, and then she got worse. Okay. And we'll pause there for a second. Let me rewind and tell you, when I talked to my mom as she was driving herself to the hospital, I had this discussion with her about advanced directives again. What would she want in the event that her heart stops or her oxygen levels are so low because of COVID that she requires intubation so that the machine can breathe for her? So we were able to talk about it a little bit, and luckily, in my family's case, my mom has said multiple times over the years, because of what she's been through with my grandma, that she doesn't want to be a vegetable and be stuck on machines. Okay. So we fast forward. She's been in the hospital a few days. She starts getting worse. She goes from, room air with no oxygen to a little bit of oxygen to more and more oxygen, requiring a BiPAP machine to push air into her lungs, but she's not intubated yet. Then um, August 2nd or August 3rd at 5 o'clock in the morning. She had a cardiopulmonary arrest due to hypoxia, meaning low blood oxygen levels because of the COVID. At which point they followed that protocol. She got intubated. She went to the ICU. And ultimately, she was in the ICU about 4.5, 5 days, and she passed away. Now, because I personally talked to my mom on the way to the hospital, and because she said those other things before that my brother and sister have heard themselves, when it came time to decide that we have to take mom off life support, while it was a very hard decision, made more difficult because we weren't able to be in the hospital with her, we understood that that's what she wanted. And so we made that decision, and she passed away without any family at the bedside, with only nurses there, which were a godsend. But that's why this is important. This happened at a time when many families, most families, are not able to be in the hospital with their loved one. And these decisions a lot of time are being made after something bad happens, like in my mom's case where she coded. And people are not ready for that. And by not being ready for that, you make an almost unbearable, impossible situation that's difficult to deal with that much more difficult, because now you've never talked about it, you've never thought about it, and now I'm calling you on the phone to tell you that I'm sorry, your mom has coded, and it doesn't look good. What do you want me to do now? And I know how hard that is, because I had to do it over the phone. I've had to do it in person. I've had to come and tell family members when that happens at night when I'm not in the hospital, this happened overnight, and I'm sorry, but your loved one is, brain dead, or there's no hope of recovery, and now we're at the end of the road. And I do not want you guys to be in that situation. It is a horrible situation. And the one peace of mind that I have watching my mom die over the phone when I can't be there, knowing what I know as a doctor, still it's hard. The one peace of mind that I have is that I did what my mom wanted. One of the things that I've seen a lot over the last 3 years is that families don't want to let go for multiple reasons. And I'm not here to tell you it's right or wrong. As the doctor, I just try to give you my opinion and the best options that we have. But from a family member standpoint, keeping someone alive, for my own mental well-being, my own wants and needs, does not transfer to quality of life or to what your loved one would have wanted. And so, because of that, that's why I think the advanced directive is so important. And I think that, doing it when you're not in an emergency situation, you're not in a life or death situation, where you can sit down with your mom and dad, your brothers and sisters, your aunts and uncles, your friends, and talk about what you want. I think that's important, and I think it'll go a long way, and I think it'll help you find, especially in this time of the COVID pandemic, a little bit of peace of mind if you find yourself in the situation that I was in. So please Google it. But like I said, one of the ways, you go to Google, advanced medical directive. You find it. You find the one, the AARP one. Pick your state, download it, make a copy, give it to all your friends and families, fill it out, follow the directions, and of course, you want to tell your doctor after you had that so your doctor knows. And then if you end up in the hospital, you give that to them as well so that they know. And of course, this is not set in stone. You can come back, next week or next month or next year, and you can change your mind on what you want. This is not set in stone, and a lot of times, even if we have that, we might ask you in the hospital again, do you want us still to do this? Or, or you can just tell us, I want to change it. Again, that makes your life a little more difficult. That makes our life more difficult, but we're here to do what you and the patient want. So don't feel bad about it. But, I think, as I tell my patients, if you're not ready to do it, I want you to very seriously think about it. And from one human being to another, I really wish you would do it. After this happened, and I've been talking about it for years, and I never filled it out. I never had my family fill it out. I went and found the states where my family is at. I downloaded the form and I sent it to everybody in my family. My dad, my brother and sister, my aunts and uncles, my cousins. I sent it to everybody. Please do it sooner than later. Okay. Thank you. And like I said, we'll talk about COVID maybe later. Thank you very much. Again, my name is Eric Spicuzza, Dr. Spicuzza. I'm an internal medicine resident. This is not medical advice. This is one human being to another, suggesting very strongly that you guys do these things for your own mental health. Okay. Please leave any comments below. As I have time, I'll try and answer them. Thank you. Have a nice day.